Treatment should be started from sterilising and dulling of nail plate. The dulling of the nail plate is carried out using milling cutter with an overlay of approximately 150 grit. Before proceeding to the next stage of the procedure, degreasing of the nail plate should be introduced. For this procedure, we recommend an Arcadia primer. It is essential to finish procedure and dry nail plate until primer evaporates completely, about 2 minutes. Once described procedure is completed on such prepared nail plate, you can apply acrylic resin under the manipulator D1. The manufacturer recommends acrylic resin containing silver ions by Arcadia. This is a safe preparation intended for the reconstruction of the nail plate. Using acrylic resin, form the ball and apply it more or less in the middle of the nail plate. A useful remark at this point is to always remember to make a hole in the applied acrylic resin in which later the tip of the pad will be placed. You can also for 2 minutes use a dryer to make acrylic resin toughen faster. When the nail plate is already prepared, put the toe in the tool. However, before you do so, you must glue pads on the patient's toe so as to relieve the pressure screws during the treatment. Place formed balls on the manipulator D1 and everything in the tool. Balls during surgery work grip, therefore before proceeding to work should be slightly unbent. Thanks to the trackball devices placed, balls find it possible to move them during the treatment and bracing if necessary. When D1 manipulator is in place, begin the most difficult stage of the procedure. Using a L-series manipulator, start to deform the nail plate. The operation should be performed slowly and very gently while remaining in contact with the patient. Using L-series manipulator, raise nail plate at right angles so that it is possible to implement the next stage using H1 series manipulator. Exactly the same procedure must be carried out on the other side of the nail plate. Using milling machine, the next step is to weaken the nail plate in bend place. The place should weaken on both sides. This allows the extraction of the nail from the shaft and also reduces the pain experienced by the patient during the treatment. At this point, we start to use H1 series manipulator, through which it is possible to get the proper shape of the nail plate and giving it a proper track of growth. When the edge of the nail will be unbundled, tighten the screw in the body of the tool so that the manipulator has remained steady. The same procedure is repeated on the other side of the nail. Starting from nail groove, apply Arcadia primer. Keep in mind that acrylic resin is applied to the whole of the nail plate. Acrylic resin allows you to maintain the effect achieved using manipulators. This is a very durable material and at the same time very flexible. It allows you to hold the proper nail growth track. Acrylic resin is dried for about 2 minutes. After curling, acrylic resin, start removing manipulators and pull out the toe from the tool. Using small amounts of acrylic resin, you need to refill a hole from manipulator. The final stage is detailing of acrylic resin. Aesthetic effect is obtained through the use of milling cutter with the overlay approximately 150 grit, the block, the file and the buffing block. At the end of the treatment, apply small drops of collagen serum by Arcadia under the nail plate. It is recommended that each patient use collagen serum by Arcadia twice a day until complete regeneration of the nail plate. Use of collagen serum helps in the reconstruction of nail plate and in the regeneration of the nail groove. Each patient after surgery should be instructed about proper nail care.